The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Trigger Finger by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video today, we will be discussing trigger finger or Tenosynovitis, what it is, how to diagnose it, and how to treat it. We will give you some simple home diagnostic tools as well as some simple home treatment remedies which may save you that initial doctor's office visit. So first of all, what is stenosing tenosynovitis or trigger finger? Essentially, this is a tendinitis that affects the flexor tendons as they're coming into the tendon sheath. Right here is where the tendon sheath starts, and it extends down here to the end joint on the finger. So as the tendons, and there are two tendons that bend each finger, as those tendons enter the tendon sheath, if there's any swelling in or around the tendons or swelling in or around that sheath, occasionally those tendons can get hung up as they're entering the sheath, and it will cause some pain or classically catching or triggering of the finger. So patients will complain of sometimes some vague pain in the palm, but classically they will have catching or locking or triggering of the digit. So it will go click, 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 click. Or occasionally patients will make a fist and then they just can't extend one of their fingers without forcing it open. Occasionally it will go the other direction. They'll be trying to make a fist, but they can't do it without pushing that finger down. This tends to be slightly more common in patients with diabetes or hypothyroidism, some other autoimmune diseases that cause some inflammation in the body, amyloidosis. These patients tend to be a little more prone to developing a trigger finger. However, most of the time this is idiopathic, meaning it develops for no reason at all. Occasionally it's associated with an overuse type syndrome. So patients can just awaken one day and they can have a finger that's locked or stuck or that's triggering. It tends to be a little more painful and bothersome first thing in the morning as you're just getting the fingers going, and a little less bothersome, you know, towards the end of the day. Something that you can do as a self-diagnostic tool, particularly if you're not triggering, if you just have pain, if you have pain kind of in the base of the palm, is do deep palpation right over where your knuckle would be in the back. So right over the front side of the palm on the other side of the knuckle essentially is where that tendon sheath starts. So deep palpation into that area typically will elicit pain because that's where the pathology occurs. That's where the area of swelling and inflammation is, over what's called the A1 pulley. So that's a thickened band of tissue that starts the tendon sheath. So the pathology is as the tendon gets swollen, it glides underneath that band of tissue, and sometimes it will get stuck on one side or the other, and that's what causes the triggering. And so that tends to be painful for patients. Also, hold over that area and make a fist or bend that finger or flex that finger. Usually you can feel swelling within that tendon, and occasionally that extra pressure on it can elicit it to trigger, so it will catch as you're holding pressure over it. So what are some simple treatments that you can do at home initially? Sometimes bracing or splinting can be helpful for this. This is not something that I routinely recommend, however. It seems like more patients than not will have increased pain with splinting. So I don't necessarily recommend that, but certainly you can try it for a few days.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on MoonlightOrtho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. MoonlightOrtho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.